Well, good morning, everyone. Getting ready for my shift. My brother's going to pick me up. He also works at the same place, so it's going to be great. Sometimes I wear my scrub cap just because when I'm dealing with wounds, I don't want my hair getting contaminated. And it's also nice because the scrub cap has buttons on the side, so it holds the strap of my mask so my ears don't hurt. So I'm here with my brother Mike. He's also a nurse at the same place. His specialty is oncology.
Hey guys.
I'll put the link to his socials in the description below. So just got in. So the commute isn't that long because we live close to work. So now I'm in the office. We have lab coats, which is cool. We usually use them for education or if we're attending meetings. I also have this awesome Star Wars themed scrub cap, so shout out to all my fellow Star Wars fans. If you haven't seen my last video, I highly recommend checking it out. It's a prequel to this video. So like I said in my previous video, sometimes you'll find yourself in an office and sometimes you'll find yourself seeing consults on the units. So typically when patients have wounds, ostomies, or fistulas that are difficult to manage, the primary provider team or the nurse will place a consult. When that consult is placed, then we see the patient. So usually when I come in, I triage my patients, basically ranking all the cases in order of which to see first and which to see last. Which patients have wounds, which patients have ostomies, which patients have fistulas. Typically leaking fistulas and ostomies are a priority because if they are actively leaking, we have to address that. Usually the wounds we see here are chronic, meaning they've had it for a long time and it's not healing. So oftentimes that's associated with ineffective wound dressings. And it goes the same for ostomies and fistulas. Usually when it's leaking, it means the current appliance is ineffective. And then after we see these consults, we discuss with the nurses, primary provider team, and then any other relevant healthcare professional. Some examples of the wounds we see are surgical wounds, traumatic wounds, pressure injuries, diabetic foot ulcers, venous insufficiency ulcers, arterial ulcers, and ischemic wounds, malignant wounds, so your patients in oncology, and every other wound. We've seen a lot here. One of the great things about working in a large academic medical center is you get to treat a wide range of cases, and you get to interact with so many brilliant professionals. We have wound vac cases or negative pressure wound therapy, which is personally my favorite part of wound care. But there are many days where we do education sessions, weekly wound rounds. I do rounding in the surgical ICU. So anyways, as I said, I'm going to do my triage and then I'll go out and see the patients. Obviously, I can't show you patient care, but we can chat here in the office between cases. But before that, I got to get some breakfast first. The good old sausage, egg, and cheese. Well, that was good. Well, I got my list of cases to see. I'm gonna go grab some supplies and then I'll see you when I'm done. So just got back from some very interesting cases. We had a case about wound vac management. A lot of patients come to the hospital setting with a wound vac that they use at home, which is usually a different brand than the one we use here. A lot of diabetic and arterial ulcers. So we help them manage it in the inpatient setting, and then we help transition them to an outpatient setting. So that's a multidisciplinary approach. And being a CWOCN, you get to do specialized education about these wounds, ostomies, and fistulas. This is important when patients and family members have very specific questions. It's super nice outside. I'm gonna meet my brother for lunch.
Oh, it's actually hot.
So it's super nice out, as you can tell. We didn't know how warm it would be, so we put our jackets on in case. But met up with my brother for lunch.
Guys, make sure to drop a follow. Our YouTube name is BritenyAndMichael. He'll put it in the description down below.
Look in the description below.
Yeah.
So it's super nice in the city, walking around.
So hot.
It's so hot, man.
It's like a heat wave, or is this just like... There's no way, because tomorrow's 50. It's probably like a wave, like a heat wave.
Probably.
Still in the middle of...
That's what happens when you live in the tri-state.
Yeah.
That's how you know you're in the tri-state. It's like really hot today, and then the next day it gets colder, and then it gets colder, and then it gets warm again, then it gets really hot. If you know, you know. Just decided to take off the jacket. There's no point. It's really warm. Getting Chinese takeout. Just finished our meal. Now we're headed back. It's so beautiful outside.
Yo, it is 80 degrees right now.
So anyways, I still got some more cases to see. I'll circle back when I'm done. So I'm back from some more chronic wound cases. So when you think of wound care, don't just think about sticking on a wound dressing. Think of wound management. What type of dressing is best? The frequency. Who will change it? How long are we going to change it for? How long are we going to use this dressing type for? Should there be any other professionals involved? For example, a lot of our cases overlap with dermatology. So just something to think about. And remember, as a CWOCN, that doesn't mean you're doing daily dressing changes. We do provide recommendations for the best treatment. And then we usually follow up weekly or bi-weekly depending on the wound characteristics and the wound etiology. And again, like before, we have to document. I like wound care because it's very niched. It's very specialized. It's a very satisfying feeling when you see a wound that has trouble healing, and then you apply your specialized knowledge and training, and then you see the wound heal. It's a very satisfying feeling. Knowing that you did something so specialized for someone and you helped them take care of one of their problems. So it may not be as fast-paced as other professions, but that doesn't mean it's not important. So I'm really glad that I get to be a part of it. So if you remember from my last video, you have to go back to school to become a CWOCN. There are a list of accredited programs, link in the description. I precept students for 2 of the programs for their clinical practicum portion, which is the portion where you come in person, or some places offer it online, or a hybrid of in-person and online. And again, I like to emphasize in-person because you do a lot of hands-on skills. Also part-time, I am an adjunct nursing professor, so I teach nursing students. And I managed to get a number of people started on their wound care journey. So we always hear about burnout. Let me know in the comments if you want me to make a video about that. But burnout is something I was no stranger to when I was a nurse at the bedside, and becoming a CWOCN really changed my career trajectory. I really felt like I was going to quit nursing because I didn't know what I wanted to do, where I belonged. Is this career right for me? And I found out a majority of that stemmed from my role at the bedside. So I always emphasize to think about the role. Not so much the specialty, but the role. Ultimately, your role can lead to burnout. And I really enjoy my role and the roles in general as a CWOCN. So yeah, I didn't quit nursing and here I am. I learned that nursing is so diverse. You can work almost anywhere, and the roles are ever expanding. You can work almost anywhere and do almost anything, which is wonderful. So again, let me know if you want me to make a full dedicated video about burnout and nursing roles. So after I deal with these cases, then I have to document. And documentation is super important because if you didn't document it, then it didn't happen. Being in wound care has significantly improved my documentation skills, which is a plus. I'm also in the process of filming a lot of wound care instructional videos. It's for a project that I call the Wound Care Archive. Basically, as you can imagine, wound care is very visual. So it's hard to explain wound care by just talking about it. It's hard to explain wound care by writing about it or reading about it. It's very much beneficial to actually see it and to be hands-on. So that's part of a CWOCN's job, enhancing wound care skills of other professionals. Because remember, it's not only nurses that do wound care. Sometimes your providers will do wound care. Sometimes an occupational therapist will do wound care. Family members and caregivers can do wound care. So being a CWOCN, being an objective expert, you have the education and skill to train everyone in wound care. So it would be a great resource to have videos to show everyone how to do certain wound dressings, how to assess your wound, how to implement prevention measures for pressure injuries. And not to mention that this is the digital age. Majority of people learn digitally. We consume our information digitally. And a big advantage to being digital is the ease of access. Let's say for some reason you missed a teaching session or a skills session. Well, how convenient would it be if I could just pull up my phone and then look at a video? I could learn right then and there. You could learn on your own time. My Master of Science in Nursing degree is in health informatics. So this is me applying an informatics solution to wound care. And I think that's so cool. My brother dropped me off today, but coming back home, I gotta take the shuttle since I finished earlier than him. And it's pretty affordable because the toll is really expensive. The shuttle's around $3.50 versus like around 5 times that amount for the toll. And then I park my car at a designated area, which requires a parking pass. So it's pretty good. Let me know in the comments how you guys commute. Well, I finally got to get rid of my scrub cap. But then now I got scrub cap hair. Well, at least it's smooth. Well, I'm clocked out and it's time to go home. It was really nice earlier, but now it's really windy and it's raining. This weather is horrible. Well, that's the tri-state for you. I used to take my scooter a lot, but they banned scooters at work. So now I've been walking. But it's healthy to walk anyway, so. I'm getting soaked. We made it to the bus station. We made it back to the car. So thank goodness the rain stopped. My jacket dried up a little bit. I actually got this jacket from the flagship Uniqlo store in Ginza, which is in Tokyo, Japan. All the links to my socials are gonna be in the description below. Whew, what a long day. Thanks for joining me on that shift. Make sure you like and subscribe for more content. I'll see you next time. Till then, stay vigilant.